Most men are doing this almost every day, but very few really know what it's doing to their body. Today, we're solving the confusion. Is daily ejaculation healthy, or is it damaging your hormones, your energy, and even your prostate? Stay with me, the truth may surprise you. You're watching Dr. Nerita, where science meets real-life health. Today's topic is one men ask quietly but urgently: what actually happens inside your body when you ejaculate every single day? I'm going to break down the real medical science, not myths, not internet rumors, so you understand exactly how daily ejaculation affects your hormones, your prostate, your energy, and even your mental health. Let's start with the basics. Ejaculation is a natural biological process. But what happens when you do it every single day? Does it help your health or hurt it? Let's break it down step by step. Daily ejaculation creates a repeated hormonal cycle inside the male body, and every part of that cycle affects mood, energy, motivation, and overall biological balance in a different way. When a man ejaculates, the first noticeable shift is the rise in dopamine, often called the reward chemical. Dopamine gives a sense of pleasure, satisfaction, and mental reward, and for a brief period, the brain interprets this as a successful positive event. But what many people don't realize is that this dopamine rise is followed by a quick drop, and that drop is just as important as the rise. When ejaculation happens every day, this dopamine rise and fall cycle is repeated constantly, and the brain begins adjusting its sensitivity. Some men may notice that their excitement levels feel slightly muted with time because the brain reduces dopamine receptor responsiveness when stimulation is too frequent. This isn't permanent damage, but it is a pattern the brain uses to maintain chemical balance, and that's why some men feel less motivated or less mentally sharp if they overstimulate daily without breaks. Along with dopamine, another hormone that reacts immediately after ejaculation is prolactin. Prolactin is what produces the calm, relaxed, sometimes sleepy feeling right after climax. It is the same hormone associated with the refractory period, meaning the body's temporary inability to become sexually aroused again. When ejaculation happens every day, prolactin stays on a tighter cycle, rising frequently and potentially affecting mood and energy patterns. Higher prolactin release too often may make some men feel low energy, slightly foggy, or less driven throughout the day. This is because prolactin naturally counteracts dopamine. When prolactin rises too often, it can dull excitement and reduce the dopamine reward cycle that normally gives motivation and alertness. One of the biggest misunderstandings men have is that daily ejaculation kills testosterone. In reality, scientific studies consistently show that testosterone levels remain stable with daily ejaculation. Testosterone does not get drained through climax. The body continuously produces it, and ejaculation itself doesn't interfere with long-term production. There may be a tiny temporary fluctuation afterward, but it returns quickly. What actually affects testosterone much more is poor sleep, chronic stress, obesity, lack of exercise, and alcohol use. Daily ejaculation alone is not a testosterone killer. However, for men who overstimulate to the point of exhaustion and sleep loss, lifestyle habits connected to that behavior may indirectly reduce testosterone, not the ejaculation itself. During daily ejaculation, the nervous system also shifts between sympathetic and parasympathetic states. Sympathetic activation is what drives arousal, stimulation, and the physical buildup to release. After ejaculation, the parasympathetic system takes over, leading to relaxation and recovery. When this process happens every day, the nervous system gets used to switching modes more frequently. For many men, this helps maintain sexual responsiveness and keeps the pelvic region active. For others who are sensitive to overstimulation, the daily switching may create slight fatigue or tension in the pelvic floor. It depends entirely on how the individual body responds, and not everyone experiences it the same way. Daily ejaculation also influences oxytocin, a hormone associated with bonding, trust, and emotional comfort. While oxytocin rises during climax, it's usually more significant during partnered sex than solo activity. However, even small, repeated oxytocin releases can create a behavioral pattern where the brain begins using ejaculation as a form of emotional stress relief. This is why some men develop a habit of doing it daily, not for physical desire, but for emotional regulation. It becomes a self-soothing mechanism rather than a biological necessity. Another important aspect of daily ejaculation is the cortisol interaction, the stress hormone. For some men, Ejaculation reduces cortisol temporarily, making them feel calmer and less stressed. For others, especially those who rely on it as a coping tool, the brain may become dependent on that temporary relief, leading to a cycle where stress increases when they try to stop. This creates a loop of needing daily ejaculation, not for pleasure, but to manage tension. The body's hormonal balance becomes tied to that pattern, and breaking it feels mentally uncomfortable. Daily ejaculation doesn't operate in isolation. It interacts with lifestyle, sleep, diet, and emotional habits. Because hormones operate like a network, stimulating one repeatedly every day shifts how the others respond. And the body constantly tries to rebalance itself without showing clear physical symptoms, unless the cycle becomes too intense or driven by stress rather than normal desire. Regular ejaculation has a direct effect on the prostate because the prostate's main function is to produce a large portion of the fluid that becomes semen. When a man ejaculates, this fluid is released and the gland temporarily empties. When ejaculation doesn't happen for longer periods, the prostate remains full, and that can lead to congestion or a sense of heaviness in the pelvic region. Daily or frequent ejaculation helps reduce that buildup by consistently flushing the gland. This process supports smoother circulation within the prostate tissue, maintaining a healthier environment with fewer chances for inflammation to settle. Many urologists emphasize that the prostate behaves like any gland that benefits from being emptied regularly to keep the internal fluids mobile and prevent stagnation. Research shows an interesting pattern when studying men who ejaculate more frequently. There are signs that regular ejaculation may lower the risk of developing certain prostate issues later in life. One reason is that ejaculation helps clear potentially irritating byproducts from the prostate ducts. These waste materials, if not cleared often, can contribute to microscopic inflammation. When inflammation becomes chronic, it's known to be a risk factor for long-term prostate problems. By keeping the gland consistently flushed, daily ejaculation promotes a healthier internal environment where inflammation has a harder time establishing itself. For many men, this contributes to reduced episodes of prostate discomfort and fewer symptoms associated with congestion, such as dull pelvic pressure or mild urinary hesitation. The act of ejaculating also stimulates the muscles around the prostate, including the pelvic floor, which is closely connected to urological function. During arousal and climax, these muscles contract rhythmically, increasing blood flow to the pelvic region. This boost in circulation can enhance tissue oxygenation and nutrient delivery, helping the prostate maintain strong cellular health. Adequate blood flow is essential for glandular function, and daily ejaculation ensures that this cycle happens repeatedly. Some patients report improved comfort, reduced tightness, and better pelvic muscle regulation when ejaculation is part of a balanced routine. For men who experience pelvic floor dysfunction or muscle tension, moderate ejaculation can serve as a natural way to relax the area by releasing muscle contractions and lowering internal pressure. Another factor in urological health is the relationship between ejaculation and urinary symptoms. The prostate is positioned around the urethra, which means any swelling or congestion can affect urinary flow. When the prostate becomes irritated or inflamed, even slightly, men might notice weaker stream, delayed start, or a feeling of not fully emptying. By ejaculating regularly, the gland stays less congested, which can lead to smoother and more comfortable urination. Some men who experience occasional urinary tightness find relief after ejaculation because the process helps reset tension in the region. The hormonal involvement also contributes to this effect, as relaxation chemicals released after climax can briefly ease stress that worsens urinary symptoms. From a urologist's perspective, one of the most compelling reasons ejaculation supports prostate health is related to the immune system's activity inside the gland. The prostate can accumulate cellular debris, microscopic pathogens, and inflammatory proteins. If these elements build up over time, the immune response in the prostate may become activated. Chronic immune activation is associated with prostate irritation and conditions like prostatitis. Frequent ejaculation helps physically expel this debris from the glandular ducts, reducing the need for the immune system to intervene. This decreases the likelihood of chronic irritation, which plays a key role in long-term prostate wellness. There is also a connection between ejaculation frequency and reduced risk of future complications, because prostate function is closely tied to hormonal rhythms. When ejaculation occurs daily, hormonal and glandular activity stays consistent, avoiding long periods of stagnation that might contribute to structural stress on the tissue. While ejaculation is not a cure-all for prostate conditions, the natural flushing mechanism and increased circulation form a combination that supports healthier functioning. Many urological specialists consider regular ejaculation one of the simplest lifestyle habits men can adopt to support prostate comfort, particularly as they age and the gland becomes more sensitive to inflammation and physical stress. When ejaculation becomes too frequent, the body begins to show signs that the stimulation is exceeding what the nervous system and hormonal balance can comfortably manage. Overfrequency affects multiple systems at once, and the first noticeable impact often appears in energy levels. Every ejaculation triggers a cycle of dopamine rise, followed by prolactin release, which induces relaxation and temporary fatigue. When a man ejaculates too often, prolactin may spike repeatedly throughout the day, creating a pattern of sluggishness, low drive, and reduced motivation. Some men describe this as a flat feeling or a sense that their mind isn't as sharp as usual. This isn't because ejaculation itself is harmful, but because the hormonal cycle is being activated faster than the body can fully reset. Over time, this can affect productivity, mood, and even interest in normal daily activities. The brain is forced to adjust to constant stimulation, and its reward circuits become less responsive, making other sources of motivation feel weaker. Another risk of excessive ejaculation shows up physically in the pelvic region. During climax, the pelvic floor muscles contract powerfully, and while this is normal and healthy in moderation, repeated contractions without proper recovery can lead to pelvic tension or discomfort. Some men develop mild soreness around the perineum, a feeling of heaviness in the pelvis, or even slight irritation in the urethra. These symptoms are often temporary but can be uncomfortable and may persist if the frequency remains too high. Overuse of the pelvic muscles can also contribute to temporary sensitivity issues where the penis becomes either hypersensitive or underresponsive. In some cases, men may experience difficulty achieving or maintaining erections simply because the muscles and nerves are overstimulated. The body needs downtime to restore neurotransmitter levels and relax the pelvic muscles. And when this rest is not given, the urological system reacts with tension or reduced comfort. A more subtle but important risk is the psychological dependency that can develop around frequent ejaculation. For some men, daily ejaculation shifts from being a normal sexual release to becoming a coping mechanism for stress, boredom, anxiety, or emotional discomfort. The brain quickly learns that ejaculation produces a reliable dopamine spike, and when that spike is accessed too often, the brain may start to depend on it to feel normal. This creates a cycle where the man feels restless or irritable without the release, leading to compulsive patterns that are no longer driven by natural desire, but by emotional regulation. This pattern can interfere with relationships, personal goals, and daily functioning because attention becomes focused on maintaining the dopamine cycle rather than engaging naturally in life. Even though ejaculation is a normal biological function, using it as a repeated psychological escape can distort emotional balance and make genuine satisfaction harder to achieve. There's also an impact on sensitivity and arousal response when overfrequency continues for long periods. The nervous system adapts to constant stimulation, and men may notice they require more intense or longer stimulation to achieve the same level of excitement they use to feel easily. This reduction in sensitivity is the body's way of protecting itself from overstimulation, but the result is that sexual experiences may feel duller or less satisfying. Performance may also decline temporarily because the brain's arousal pathways are tired, similar to how muscles fatigue after being worked too hard without rest. In extreme cases, some men may develop delayed ejaculation, where reaching climax becomes unusually difficult due to overstimulated nerve pathways. Another potential risk involves the emotional aftermath. If ejaculation is used excessively, the post-climax dip created by prolactin may intensify feelings of sadness, emptiness, or low mood in some individuals. This effect isn't universal, but when it happens, it creates a cycle where the man feels low after releasing, then seeks another release to fix the discomfort, only to feel low again afterward. Over time, this loop can subtly affect mental resilience and emotional stability, making daily stressors feel heavier. The body and brain work best with balance, and when that balance is disrupted by overfrequency, the hormonal, physical, and psychological systems all begin responding in ways that signal the need for moderation. Daily ejaculation interacts deeply with a man's psychological patterns and lifestyle rhythms, shaping not just physical responses, but emotional habits, mental clarity, and day-to-day motivation. When ejaculation becomes a regular part of daily life, the brain begins forming associations around when, why, and how the release happens. For many men, it becomes a quick source of dopamine and short-term stress relief. Dopamine creates a momentary boost in satisfaction, comfort, and reward, which feels good in the moment but fades quickly. When this pattern repeats daily, the brain starts linking that dopamine hit with emotional regulation. This means that instead of dealing with stress, boredom, or frustration through healthy outlets like social connection, movement, or problem solving, the brain learns an easier shortcut: ejaculation. Over time, this trained response can reduce emotional resilience, making it easier to rely on pleasure signals rather than developing stronger coping skills. This shift doesn't always lead to dependency, but it can subtly affect how a man manages stress, pressure, and daily challenges. Another psychological element connected to daily ejaculation is the way it impacts confidence and mental focus. During ejaculation, prolactin rises and temporarily decreases alertness and drive. When this happens occasionally, the effect is mild and harmless, but when it becomes a daily or multiple times daily experience, prolactin may cycle too frequently, creating patterns of reduced motivation or mental sharpness. Some men describe this as feeling drained mentally, even if their physical energy seems fine. This isn't about testosterone loss, but about the brain adjusting to a hormonal routine that prioritizes relaxation chemicals over performance-related focus. Lifestyle routines such as work productivity, studying, fitness consistency, and long-term goal pursuit can be affected when the brain grows accustomed to quick dopamine cycles followed by periods of low drive. Instead of building momentum throughout the day, motivation becomes uneven, rising briefly when pleasure is anticipated but dropping sharply afterward. Lifestyle balance is also shaped by how ejaculation fits into a man's schedule and habits. For some men, daily ejaculation is part of a structured and healthy routine that doesn't interfere with responsibilities. For others, the timing may disrupt sleep cycles or productivity. Ejaculation releases hormones that promote calmness and drowsiness, and if done late at night, it may help sleep. However, when done at random times during the day, especially in the middle of important tasks, it can momentarily lower engagement and reduce the mental intensity needed to stay focused. This creates a lifestyle pattern where the brain expects frequent breaks for stimulation and relief, making long stretches of concentration harder. Physical habits may also shift. Excessive sitting, screen time, or isolation can develop if ejaculation becomes the preferred method of relaxation rather than more active or social activities. The psychological impact also shows up in relationships and social behavior. When daily ejaculation becomes a private habit that substitutes emotional connection, it can reduce the desire for real intimacy or deepen avoidance of vulnerability. Not because the act is harmful, but because it offers a controlled, predictable way to access comfort and reward without navigating the complexity of human interaction. This can influence dating patterns, communication style, and emotional presence. For men who are already dealing with stress, anxiety, or low self-esteem, relying on ejaculation as a quick relief can make deeper emotional needs feel neglected. Maintaining psychological and lifestyle balance requires understanding why the behavior is happening and recognizing patterns that feel automatic rather than intentional. Some men thrive with daily ejaculation and feel relaxed, confident, and emotionally level. Others may notice that their mental clarity, motivation, and emotional strength improve when they find a rhythm that includes rest days or more intentional habits. The key is staying aware of how the mind and lifestyle respond instead of assuming the physical act alone determines well-being. Healthy balance relies on recognizing personal limits, listening to the body's signals, and staying aligned with habits that support long-term emotional strength.